Hello, my name is Smirnov and I am from Ukraine. I am confident that our research is both important and relevant. Today we must be united, responsible and ready to support those who need it most. The world faces serious challenges and my homeland suffers from unprovoked aggression by the Russian Federation. I realized I wanted to be part of changes that help people regain their health and hope for the future. Physical therapy for military personnel is an essential part of medical care in any country's armed forces. Fast recovery of combat readiness and fitness for duty is critical. This motivated me to study the use of VR technology in physical therapy for military personnel with post-traumatic ulnar neuropathy. This condition has several specific challenges, including a high rate of complications that affect an active lifestyle. It often causes long-term disability and makes returning to military service difficult. Seeing how digital technology is developing rapidly in many areas of life, I decided to bring the process of functional recovery for injured limbs into a virtual environment. I wanted to test how effective it could be for military personnel with post-traumatic ulnar neuropathy. You may say that combining virtual reality with physical therapy is already a common practice in leading rehabilitation centers abroad for patients with Parkinson's disease or post-stroke conditions. However, its use for ulnar neuropathy is still not well studied. This makes our research innovative and promising for a condition also common among civilians, professional athletes, office workers, and drivers. To identify specific symptoms, assess functional impairments, and track patient progress, we use functional testing. The study was conducted at the Kropivnitsky Regional Clinical Hospital for war veterans. We worked with military personnel diagnosed with mild to moderate post-traumatic ulnar neuropathy. Based on a physical therapist's recommendations, we developed a set of therapeutic exercises and integrated them into a virtual environment. We created a specialized program for the Oculus Quest 2 VR headset. The program was built in the Unity environment using the XR Interaction Toolkit with controllers for both hands, so patients could interact with virtual objects during physical therapy sessions. The goals were to support nerve regeneration, reduce nerve conduction block, restore fitness for work and normal movement, improve blood flow and tissue nutrition in the affected area, prevent contractures and joint stiffness, and strengthen paretic muscles and ligaments. The patients engaged in the developed set of therapeutic exercises, which were divided into 3 main groups and included additional exercises to integrated hand functions. Virtual puzzles, manipulating objects that require precise movements, a virtual motion simulator. Patients performed exercises for finger, hand, and elbow flexion extension in the form of interactive tasks, and a rehabilitation quest. Military personnel went through a series of missions in VR that involved using their hands to perform tasks such as opening doors. Also, it should be noted that the patients and doctors provided positive feedback, noting the effectiveness of the VR-based method. To evaluate the effectiveness of using VR in physical therapy, we combined clinical examinations by a physical therapist and a doctor with ongoing analysis of the functional test results. We observed improvements in both the control and experimental groups. However, the improvements were significantly greater in the experimental group. This confirms our hypothesis that using VR is an effective approach for the physical therapy of military personnel with post-traumatic ulnar neuropathy. Our research has practical value. The VR training simulator is cost-effective because it works autonomously without a PC, internet or extra equipment. This lowers logistical cost and improves efficiency. The device doesn't require extra training for the physical therapist, and the built-in functional tests allow precise tracking of exercise quality. This makes physical therapy more effective, accessible and convenient, and the training simulator itself is a practical solution for the rehabilitation of patients with ulnar neuropathy. I want the world to hear about my research because it can help many people return to a full and active life. I'm ready to move forward and give my very best.